the first question. You should pick the sign that is not sign of maternal sepsis. So, Dr. Datta, I think that most of the participants gave the correct answer.
Yep. So,
yes. In fact, as we could see on the slide, it is quite the opposite. Yes, the low blood pressure is the sign of.
Low blood pressure is the sign. You're right, and obviously you will have a dilemma if you've got a patient who comes in who has had hypertension in pregnancy, and a pregnancy is complicated by hypertension or preeclampsia, and there's nothing to say a preeclamptic patient will never have sepsis. So you could have a normotensive patient, for example, where blood pressure is compromised to a degree, and yet she's not hypotensive or low blood pressure. So always look out for those signs, because two or more pathologies can coexist at one time. For example, sepsis and PPH, they go hand in hand. Hypertension and sepsis might also go hand in hand. So remember, if somebody's previously has, always check and make sure you have seen that her previous record has been normotensive, and then diagnose hypotension, whereas somebody has been hypertensive, then maybe a normotensive woman in sepsis might seem normal for her. Okay.
Yes, thank you very much for the comment. We go further. Marie had the quickest answer. So now you have to answer with true or false. So there is a dilemma, Dr. Datta?
Yeah, so sepsis accounts for 25% of maternal death causes in the developed world. I think there is no right answer for that. In the developed world, I said, which means we're talking of Europe, North America. So it's unlikely to be more than 25%. So it is likely to be less than you heard in that slide was about 11%. So I would say probably 11 to maybe 15%, maybe even 17%, but not as high as 25%. So that.
And in developed world, the bigger cause and the most common cause is going to be the bleeding. Yes, is it true?
Hemorrhage is true worldwide. Yeah.
Yes, postpartum hemorrhage alone takes 20% in developed world, as some statistics says.
Exactly.
Yes.
Exactly.
Let's go further. Sabrina took the first place, so the competition continues. So what about puerperal infection? What does it include? Endometritis. And this is also the question, because I also choose these answers. So would you find also salpingo-phoritis for the puerperal infection, or what do you choose like a correct answer?
So the correct answer is puerperal infections include urinary tract infections, salpingo-phoritis, and endometritis, but it does not include respiratory tract infection. So urinary tract infection is true, salpingo-phoritis is true, endometritis is true, as a lining of the womb. You can have infection of the tubes and ovaries, you can have infection of the bladder, but the respiratory tract infection is not counted as puerperal infection.
Yes, and can you give us an explanation, because some new definition divide definition of puerperal infection and puerperal sepsis.
Yes. So
as you mentioned.
Yeah, that's right. So you could have respiratory tract infection secondary to infection arising in the genital tract. I think that is what we're trying to say. So if you've got an infection arising from an infected lining of the uterus, like endometritis, and then it spreads to the bloodstream and then causes lung infection, obviously that lung infection is secondary to infection arising in the genital tract. It's like metastasis of breast cancer. You have to find out the mother tissue where the cancer started. So any cancer, can metastasize to the brain, for example, but the primary site will be somewhere else. So similarly, puerperal sepsis or infection will actually reside in the female genital tract, which is the endometrium, which is the tube and ovary, which is the urinary tract, but not respiratory tract infection, because that is a secondary site of infection. Okay.
Thank you for this clarification, and I think we all remember now that genitourinary tract is the origin of the puerperal infection. Yes?
That's correct, yes.
So, what is the organic function? Variables in puerperal sepsis included. One is wrong. Yes, do you find thrombocytosis is the correct answer?
Yeah. So usually you will have thrombocytopenia because there is a decline in most of the blood cells, including the neutrophils. Well, initially there will be neutrophilia, but then you can have neutropenia. But thrombocyte, again, platelet count will go down in severe infection, which is why she enters into DIC. So it's not just the consumption of the clotting factors, but also the platelet count diminishes, which is why it makes DIC easier. So thrombocytosis is the one out here. Yeah.
Yes, thank you. So what about this procedure, obstetrical procedure? If we do the internal pedal inversion, it is going to be a risk for maternal infection or not? So the statement that it is not a risk factor is false. So it is.
It is the risk factor. Like we said, any intrauterine manipulation can contribute. So even manual removal of placenta can increase the risk of sepsis. Yeah.
And it is very important to keep the procedures of antisepsis and asepsis. Do you agree that I will comment later on this? Okay. The final question: if the stazotine is the first line antibiotic for puerperal sepsis. False. So yes, we could see that. Yeah, we will not start with piperacillin.
Yeah, broad spectrum penicillin is probably the first line. Yeah.
Yes. So what I wanted to ask is just a comment that one of the important factors is the not appropriate asepsis. I mean the dirty hands of the surgeon or obstetrician. Mm-hmm. So this is a preventable cause of infection, yes. And this is what is priority for us to keep in mind. Yes.
Yes.
Thank you very much, Dr. Datta. I will now use the opportunity to ask the audience if there are some questions, because Dr. Datta is on night shift and he is going to leave us soon. So if there are some questions from the audience, please write in the chat. Thank you, Dr. Datta, for joining us. This was our first collaboration, but I hope not the last.
Yes, absolutely. Thank you very much. Thank you.
Thank you very much. If there are some questions, I will send you an email maybe to answer later.
I will write the answers back to you.
Yes, thank you very much.
Thank you. All the best.
Goodbye.
Goodbye. Bye-bye.